We are not going to have roadside shows because we know for a fact that this is going to have an effect on fellow Kenyans. So we don't want this disease to spread so much that it begins to acquire political names for the reason why it is spread in the first place. And I think we must take responsibility and own up and appreciate that going forward, if Kenyans begin to fall in the streets, political leadership that is creating those gatherings must take responsibility and own up to that fact. The people in bars who are allowing, like the ones now I'm told in Langata Road, which we had closed a while back. Now I am told that there is even a new dance that is now the main thing in those bars. I can't remember if it's Jerusalema or something. That it is the main activity now. That once Jerusalema gets in, all measures go out. Please, can you dance Jerusalema keeping social distances? You know, nobody's stopping people from dancing, whatever it is called. But at least you can be able to dance keeping a social distance. I'm told it's not an intimate dance where you need to hold people. So, anyway. Saada, Hassan, mass testing. No, we have not yet gone into serious mass testing because of the two reasons that we give. A, it is really why it is necessary, and B, the affordability. As we have explained before, it is expensive. So we tend to look at the areas where we know we must test. For example, as kids begin to go to school, as universities open, we are discussing with the Ministry of Education so that we are also able to make ad hoc visits and tests to see whether it is spreading in those institutions. So, Shimtai, as we get more reagents, we test more. But we are also aware that we don't want to test to the extent that is wasteful. So let me ask Dr. Amos to respond to the other question.
Thank you, Waziri. Thank you, CS Musheru. Just to add on to the issue of the safety of children in our schools, is that we have developed protocols and guidelines together with the Ministry of Education, and we are supervising and monitoring the implementation of these protocols in schools through the county health surveillance teams. But the surveillance teams are also on the lookout for any surge in number of cases in schools. So we have trigger actions that will be able to alert us if something is happening in a particular school. But of importance is also the need to shield pupils, teachers, and auxiliary staff with coexisting medical conditions to ensure that they stay safe because of that frequent interaction. Remember, this was also the reason why we had first opening, so that we could be able to ensure that we maintain the public health social measures, including physical distancing. The severity of the disease, if you listen very carefully to Waziri's statement, the disease is severe in those who are over 58 years old, especially in our setup, even though that population fragment only accounts for about 4% of the total caseload. In terms of mortality, they account for more than 50%. So if you are more than 58 years old, you get COVID disease, you have a 50% chance of dying. Of course, notwithstanding the other risk factors, including morbid obesity, diabetes, cardiovascular diseases, and other coexisting conditions. Regarding the nature of the disease, we are monitoring very, very closely again. If you go back 2 months or thereabouts, our admission rates were about 450 cases in all the institutional facilities. Today we have 991. So that figure has more than doubled in the past 2 weeks or so. That tells you that whatever is happening at the community level is that we have widespread community transmission of the disease, and more people are coming to the facilities. If you also look at critical care, we are in numbers below 10. As of today, again, we have 28 people in ICU, 10 of them under ventilatory support, 14 on supplemental oxygen, and 4 under observation. Again, telling you that we are getting more severe form of the disease. And what is also unique in this second part of the infection is that all age groups are affected. We are losing more and more people who are younger and who don't have any coexisting medical conditions. So the more the need for us to be able to take the necessary precautionary measures as we have continued to articulate. Testing has been a real challenge worldwide over, and now will even face more headwinds. As of today, we are in a better position to be able to test, and that is why, together with the Nairobi Metropolitan Services, we have commenced on a mass testing to be able to tell us the magnitude of the pandemic in Nairobi County. But also you remember that what is happening in the rest of the world, including Europe, more and more cases are being reported, and therefore going forward, more reagents will be required. And of course, the first world countries, because of their ability to marshal huge resources, will always get first priority. That is why in our testing we'll continue to be guided by our testing strategy, which talks of those who meet the case definition criteria, symptomatic cases, and contacts who also exhibit symptoms. Ideally, the best scenario would be if we were to test one person per 1,000 population. Looking at our population in Kenya, if you estimate that at 50 million, then per week we need to be doing 50,000 tests. Therefore, per day we need to do about 7,000 tests. Now with the kits that we have, we are headed that direction. That will tell us the true picture of how the pandemic is evolving at the community level. Again, in terms of death, the other thing that I need to emphasize on is better data collection, because we now have desk officers at the Emergency Operations Center who link directly with the counties to be able to pick up the data as soon as we get the information. Then we are able to update our line list. We can be able to provide a breakdown on the number of deaths based on at home and also the facility, but majority of our deaths have continued to occur at the facility level. But of course, if you look at our case fatality ratio, it has remained around 1.8, 1.9% compared to the global average of 3.2%, because each and every day our clinicians, our doctors, our nurses, our lab scientists continue to learn and are able to implement measures that have gone a long way in saving more lives. Thank you, Waziri.
Thank you very much, Dr. Amoth. One more thing before I hand over to my colleague, C.S. Mushero, is also in regards to what Mwangi had asked earlier, and I think also, Shemtai, the issue of the political rallies. Let me also add one more item. And this is to say, sometimes even the citizens themselves make it very difficult for the politicians not to have those rallies. Because if a politician is driving around or getting out of a meeting and you gather around and you stop the person, the politician, from moving, you cannot really blame that person for beginning and starting to address those people. So it is not just the political class, it is also citizen responsibility to realize that as you go towards the political rally, you are exposing yourselves. So don't blame just the politician who is standing on the roof of a car and addressing you. Blame yourself also. If you are not there, they won't be there. I have never seen a politician stand in front of a main chamber with nobody and then start making an address. So it is not just them, it is also the citizens who crowd around the vehicles and then make it impossible for people not to have those sort of political rallies. And I thank you and pass it over to C.S. Mushero.
Thank you very much, Waziri. Mine is really brief, is one, to thank the media and to thank all those that have continued to put a lot of effort in ensuring that we continue to contain this pandemic. We were hopeful that it was reducing and that we would be able to see the end of it. And unfortunately, we are seeing it actually growing, as you have actually indicated. More importantly, during the NAC meeting, or the National Emergency Response Committee meetings, the discussions we've been having is what this means. For a long time, over the 7 months, people have been asking, please open the economy. And we've been opening the economy. The president has looked at ways of ensuring that our economy continues. But if we lose this individual responsibility that we're supposed to have, then we go back to a situation where it's now between health and the economy. And health will always be the one that takes preference. So mine is really to urge Kenyans, please, please take personal responsibility for yourself and for those around you. Take care of the country, because we need both the economy as well as yourself. But the trend that we are now seeing, it's getting to a position where measures may need to be taken. And if they are, then we will end up even with more suffering. Please, media and all the people involved, don't tire. Continue with the efforts that you're putting in place. It looks like the battle is going to be bigger as we continue, and we need you to be strong. We need you to be committed as you have been, and we look forward to being able to win this battle. Please just take personal responsibility. Asanteni sana, Waziri.
Thank you very much.